Good afternoon and welcome to the Multicultural Media Online Forum, hosted by the New South Wales Ministry of Health, Multicultural Health Communication Service, and the support of Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for this session. And we have here with us Dr. Kerry Chant, Chief Health Officer of New South Wales Health. We're pleased to have her with us. Dr. Kerry Chant, thank you for joining us.
My absolute pleasure, Jess.
Yes, and before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past, present, and emerging, and pay respect to our Aboriginal colleagues and those joining us today. We also pay respects to multicultural communities and refugee communities who are joining us for this session. Thank you for joining us. Dr. Kerry Chant. Kerry, we started the year in February with the Multicultural Media Online Conference with some information on how to keep healthy with festive season. Now it's summer, and it is important for us to remember that there are key messages that are being aligned. And then one of it is the summer campaign. And you can now feel that there's dangers of heat waves now. And so I think that's one thing that you'd like to remind people about.
Clearly, being too hot or too cold can really impact your health. And as we get into those warmer months, prevention is the best thing we can do, Jess. So being mindful that the heat in the middle of the day being the strongest part. So if you've got to do those activities, try and program them into the beginning of the day or the end of the day when it's cooled down. We know that particularly heat impacts on very young children, older adults, and those with some chronic conditions. And so be very mindful and thoughtful about the heat's impact on those age groups. So for instance, if you have a neighbour who's struggling to walk up to the street, think about giving them a lift. Check in on your neighbour and just to check that they've been able to get their essentials. Do they need help? Have they got access to cool environments? And it might mean taking them to a cooler place or inviting them over if you've got a cooler environment. So just those little extra steps to be conscious that heat can impact, particularly those very young, very old, and those with some underlying health conditions.
And what you're saying, Dr. Kerry, the fact of the matter is, I think it's just being supportive of the people around us. There could be some people, like you're saying, that there are those neighbors of ours who may be who are elderly, and those people who may have been pregnant. I have a neighbor, and she's actually just had a new baby. So during this heat time, we should be taking that extra precaution to help others as well.
Just recognise that it's going to be a little bit more of a impost or a struggle if you've got a young baby, to keep that baby cool. So it may be that if you're choosing to invite her out somewhere, it might be a cooler environment, an air-conditioned environment. You may want to offer help and support as you would to support your neighbour. The challenges of having a newborn are probably evident to many of the listeners.
Dr. Chant, what are the symptoms that people should look out for, the heat-related illnesses that is common for during the heat time?
So really we see this progression where the impacts of heat start to accrue. So you might see things like pale skin, you might have headache, you might know that you're not passing urine as much, or your urine's darker in colour, you might be irritable, all the way through to that's sort of some characteristics of heat exhaustion. But if we get to heat stroke, which is the severest form, it's actually a medical emergency. So if you have confusion, slurred speech, agitation, loss of consciousness, dry skin or heavy sweating, muscle twitching or seizures, these are signs of absolute emergency and call 000. So my message to the listeners is, please just think about the impact heat could have, noting that heat impacts people differently, and it's going to have a greater impact on newborn babies, the elderly, and those with underlying, chronic conditions. Think about how we can support our friends, our family stay cool, and what part we can play in supporting our community.
Other basic steps that, yes, we and who should we call, and what are the basic steps? Should we put them in a cool place if it does happen? What are the basic steps we should do? And I know that there are services to call when this happens.
So certainly, as I said, with the more acute, severe end of the spectrum, it's really a call to the ambulance service. The other, if you're worried at all about heat's impact, call Health Direct and they can walk you through the symptoms you're experiencing and give you that advice over the phone if you're in any doubt. If you're in the earlier phase where you just realize you're getting hot, simply just move yourself out of the sun, get into a cooler place that may be inside your home, keep those curtains closed, try and put, our fans can move air around, use mist spray on your skin, you can have a bath. There's a lot of tips to keeping cool, to getting cool or keeping cool, and you can go to our Beat the Heat website on New South Wales Health for a number of those tips.
Dr. Chant, when heat comes, there's also that the risk of food going bad, and food safety is one of the key concerns as well, that people might have allergies or because the food is not in the right temperature as well. So there could be some risks as well when it comes to being hot.
That's right. So when we take our food outside the temperature of our refrigerator, the bugs on the food or anything in it can really grow much more quickly. So clearly, and food can spoil. So it's really important that we're just mindful of making sure that we take out appropriate sizes of food, and quickly after people have had their serves, put any food that needs to be refrigerated back into the refrigerator to keep it cool. Again, our website's got lots of food safety tips, and we'll circulate those links with this presentation.
And this is very common because what happens is the holidays up, festivities are happening. It's December, and so lots of parties and lots of gatherings with communities and also with families and friends, and even at the office, isn't it? I know that there are also animals or anything, diseases that come our way. And then when it's hot, there are mosquitoes. I remember going to a picnic one time for Christmas, and there are so many mosquitoes. What are the risks for that?
So firstly, mosquito bites are not pleasant. So I would encourage you to avoid those. Wearing long, loose fitting clothing, using insect repellent, particularly with DEET in it. Also, making sure that sorry, I'll just take a sip of water, Jess.
Yes.
We also know environments that are wet and damp are going to be more prolific of mosquitoes. So particularly if you have allergic reactions to mosquito bites and others, you might want to really steer clear of those watery, damp environments where there's going to be inevitably mosquitoes present. So just those precautions around the types of clothing you wear, using the insect repellent, avoiding those areas if you're particularly prone to allergic reactions, but making sure you're well covered if you're going there to really avoid those mosquito bites, because they can also transmit a range of viruses. So in some parts of the state, there's viruses such as Japanese encephalitis, there's others called Kunjun, Ross River virus, and Barmah Forest virus. So again, if you go to our website, you can see which areas are impacted. But as a general precaution, please try and avoid mosquito bites.
And there are options to get vaccinated for these diseases.
That's right. There is a vaccine for JEV, but when you're vaccinated, it's only against the JEV virus. So therefore, it still is important to be vaccinated. We would really urge, if you're in a JE risk area, that you get vaccinated, but most importantly, that we just use those general mosquito protection measures.
And Dr. Chant, most of the time, a lot of people are wearing, when it's hot and sunny, they tend to wear short sleeves, but it is precautionary to make sure that there's long sleeves as well to keep yourself safe.
Yeah, wearing those light coloured, long sleeved, loose fitting clothing can really reduce the risk, and also making sure, if you're particularly in those mosquito prone areas, that you're wearing covered socks and covered shoes.
Yes, and yes, so I always try to make sure that I have long sleeves because like you said, it's not pleasant to be bitten by mosquitoes and also too hot. This is the time when a lot of people are also holidaying and going on trips overseas, and even just like you said, in some areas, regional areas where people are can be affected by mosquito bites. What are the tips for people in terms of traveling and also visiting their GP for important medicine and vaccination?
So before you travel, it's always good to have thought about it and planned it well. So go to the DFAT website, and that will give you some tips about the place you're going to be visiting and some particular considerations you might have. But in general, we want to make sure that you're vaccinated and you're up to date with your vaccinations, and to check if there's any particular vaccinations that are recommended. Now, it may be that in some cases, you're recommended to have hepatitis A vaccine. There may be other cases where you're recommended to have, for instance, yellow fever vaccine. So please check at what vaccines are recommended for the country that you're going to. There's also considerations of just being a bit more mindful that we're very fortunate in Australia to have good access to running water that's very safe to drink. In some parts of the world, water may be contaminated or at risk. And so really know the place you're going, what's the quality of the water, what the recommendations are about whether you can drink the water. If not, take the appropriate precautions, which might be boiling the water or drinking bottled water. There are some specific recommendations if you're going to places where there is malaria, so mosquitoes that can carry the malarious parasite. And again, your doctor may recommend, if you're going to some of those areas and are considered at higher risk, to take some medication that will prevent the malaria. Again, the doctor will talk to you about your risk and balance risk and benefit of whether that medication is appropriate for you. And also there's some guidance if you're going to any high altitude areas and countries. So climbing mountains or doing other adventurous things, there's recommendations. So please check, and your family may have grown up in a country, but it's still wise to check what the current situation is like and what vaccines are recommended and what precautions you need to take, particularly if this is your first time going back to visit family and extended family overseas.
And there's a lot of respiratory infections that could happen, isn't it, when you're traveling to different places?
So we've actually seen quite a persistent flu season this year. So I would recommend that you do check that you're up to date. We are seeing measles as a particular re-emergence of measles in many countries overseas, and it is important that you had those recommended 2 doses of the measles vaccine. And if you're uncertain, please check with your doctor or pharmacist. So measles is a particular issue we're seeing in returned travellers, but we do see a variety of other other illnesses such as typhoid and hepatitis A in returning travellers. So again, just check what vaccines or medication you should take to prevent some of those issues and tackle those health problems. But be up to date. I would recommend that you're also up to date with your regular vaccines, your pneumococcal vaccines, your chickenpox vaccines, all of your other vaccines. I would recommend you're up to date. The last thing you want is your holiday impacted by a vaccine preventable disease.
Dr. Chant, are there any cases with COVID and other cases that we've seen with our RSV?
So again, there are recommendations for COVID vaccine. So again, if you're eligible for COVID vaccine, I would urge you to comply with those recommendations. Certainly discuss those and check whether you are recommended to have them or whether it's strongly recommended. So again, have that discussion with your doctor about COVID vaccine. Check what they're recommending in relation to influenza and also pneumococcal and other vaccines.
And also, I was thinking, we had a chat about this before, but it's also not just being careful of planning ahead with all this medicine, but sometimes when you're traveling, just even in the plane, there could be some things that you should be careful about, right? Being just staying so long in the airplane. So there are tips to keep yourself safe.
That's right. So being stationary in a seat for a long period of time. So I know the hostesses and the advice packs in the back of the seat sometimes give you advice. The reason they're doing that is that long flights can lead to blood sort of stagnating and becoming much more clotty, and that can raise risks for things like pulmonary embolus and other clots. So please do those exercises they tell you within the bounds of the seatbelt signs. Please just take opportunities to have a bit of a walk, but do those exercises in your seats, and that's going to keep you a little bit, reduce that risk. There are certain groups. So if you have any underlying health issues, if you've recently had surgery, I would really check in with your doctor about are there any other particular recommendations? And in some circumstances, there are recommendations not to fly just immediately after surgery and other things. So please, if you've got any health conditions, just check in with your health practitioner around are there any other specific advice that you need to be aware of.
Dr. Chant, in terms of, yes, all these symptoms and sickness, physical sickness, but there's also the concern that during these festivities, during this time when end of the year celebrations, there is that important matter to keep people safe in terms of their mental well-being as well. So what is it that we should be reminding people or when they're seeing any of these signs within friends or family?
I think it can be a challenging time of year for many, and it is important that if you're concerned about your loved one, that you seek some advice and support. Now, if that is your general practitioner, but there are also Health Direct is a really good source of information, and they can also connect you to other services. But it is important that you do reach out for help for your loved ones or for yourself if you are feeling your condition is worsening or you're feeling that there's been a change. And I think I'd also reassure your listeners that health services are open all through the Christmas period. So regardless, there are services available. We really do want you to reach out for help. And so if there is any deterioration in your mental health, please seek help.
Mm. And there's a transcultural mental health line for language support. So we've added that on the chat. And for those watching, if you have any questions, please let us know. Dr. Kerry Chant will answer some questions if you want to seek her advice. One of the things I wanted to check as well in terms of you're saying that making sure that you're safe in the mental health and well-being and support. When you said the health services are available, I think there's also that need of being kind to each other during this time because sometimes when we're all stressed out, I think this is the time when we're all stressed out during December and leading to the new year.
Well, I think one of the beauties of of our multicultural communities is the importance of family, and this is an amazing time where many families get together. That brings its own opportunities and challenges, and so probably giving yourself space or working through strategies with you if you need some downtime, and also it's okay to reflect on your own needs. And just take a bit of a step out and plan some things that you enjoy doing. This time can be quite hectic and busy. So also just giving yourself permission to care for yourself so you in turn can care for others.
Dr. Chan, I'm going to ask the Chief Health Officer, what do you do to just de-stress and, your tips for yourself?
Well, one of the things is you probably see me sipping on a cup of tea. That's because I like tea, but I actually find just having a lovely pot of tea, if I can find a really good book that I'm interested in, and then a nice quiet space, I'm very, very happy. Or I'll watch something on the screen, and it won't be anything that's too demanding or intellectually challenging. It'll be just something that makes me feel happy. So that's my tips for me. But everyone has got their personal ways of relaxing or letting themselves go and refocusing.
Mm. I like to do some jewelry making. So that makes me cool down and calm down because I focus on that. Young people are also could be a difficult time for some people because there are some students and international students and maybe far away from their families, and it is really important for us to just keep in touch. And this is what you were saying, Dr. Chant, is just making sure that the people around you, that you also just check up on them.
That's right. And Jess, I think you probably put in the chat that there is a mental health line that is available and manned. And so again, my point to people is services are available. They're available to overseas students and others. But I think it is an important time of year just to think about other people's experience of the festive season, maybe just reaching out to check people have got plans. Do they want to come and attend your functions? Just those little acts of kindness that we can do, noting that many people may be far away from their own family and friends, and it's just a welcoming hand, whether they take up the offer or not, but a genuine offer of how you're thinking of them and, a welcomeness to embrace them into other events that might be going on.
Mm. This is also one of the key advice from New South Wales Health, from a New South Wales perspective, Dr. Chant, is about eating well and being physically active. I know that in the first part of the year, it was about trying to take the stairs instead of taking the elevator.
Look, I think we all know that being physical active and eating a healthy diet is what we should do. And it's a question of how we each of us manage that with all of the demands and challenges that we face. But a couple of things. As we get older, it's even more important that we're physically active because if we don't use our bodies, we lose the capacity to use them. And We get breathless more often, so it's even more important for us as we age to be physically active. Just think about how we can make those little changes that you can. So just thinking about it, I've recently changed to public transport, and that really allows me to have probably 15 minutes each end, or 15 to 20 minutes each end of a bit more physical activity, which seamlessly fits in because my travel time has not got longer. Then thinking about the stairs, when we get to the train station, do we sit on the escalator, or do we try and test ourselves and walk up those stairs? So little things that you can do that just build it in as routine, and things that also finding things that give you joy. Like, is it around going for a walk with the family, playing ball with the family? What are the sort of things that you wouldn't even see as exercise, but they're actually keeping people active? And I think it always brings me joy when I see kids running around, and fathers and mothers and extended family chasing each other around, and that's really good physical activity. So I think the challenge for us is sustainably increasing our physical activity, and that's going to be unique to everyone, but just thinking about what works for you, but in a way that you can do it all the time, rather than I'm really going to be fit for this next week or something like that. I think that's the challenge for us, how to maintain it. So Jess, you need to ask me this question in the new year, whether I've managed to maintain a little bit of physical activity over the Christmas New Year period.
Yes. And also, there's no judgment at all, isn't it? There's a lot of, I think that's something too, that what is it that you feel comfortable doing? And there's no, that you shouldn't be pressured by anyone.
That's right. And I think it's about finding a sweet spot. I mean, but also I think we can give ourselves some, polite nudges. Does a neighbour want to go and do aqua aerobics with you, or go for a walk in the evenings a couple of nights a week? It might be good for both of you for different reasons, that social engagement, but also, that additional nudge to yourself, even if you're feeling a little bit tired, you don't want to let the neighbour down. So just figuring out those little things that can keep us active. And it doesn't need to be running a marathon. It can be how we embed physical activity into our routine activities.
And you just nailed that on the head, Dr. Chan. It's about social connection and just being engaged with the community as well.
That's right. And particularly picking those activities that bring you together. And as I said, we're conscious of people's time, but if you can just incorporate those small little changes, they're sustainable changes, that can make a big difference.
And wearing the hat when you're going for walks and making sure.
That's right. The hat and the long sleeve sun protection. We do have a beautiful environment in Australia, but our summers can be quite challenging. So please, again, if you're doing those physical activities, do it in the beginning of the day and the end of the day. Don't go and, particularly if you've got any vulnerabilities, do it in the heat of the day. Try and do it at the cooler ends of the day.
Dr. Chant, one last message for the community. We know you have people who watch the recording as well, who listen to us regularly, and with health messages from Ministry of Health and Multicultural Health Communication Service and the support of Multicultural New South Wales. Any last messages that you have for the end of the year for 2025?
Look, I just wanted to thank the community for all they do for each other, and just wish everyone a happy festive season, whatever it looks like, a happy summer season, whatever it looks like for individuals. Please enjoy, stay safe, and remember those, just a few of those little messages we've given today. Go to our website, but also remember our services are here to help you. They remain open during the Christmas, New Year period, or any, over those periods. They're there 24/7. There's always call lines and other services. So please don't hesitate to use those appropriate services.
Thank you so much, Dr. Chant. Stay safe and hope you have a wonderful festive season with your family. And we'll see you again next time. Thank you for all the support. And for everyone listening, thank you so much for joining us. We'll see you again in 2026.